pass it over to my good friend and colleague, Dr. Veronica Sandoval from Genentech. Hey, Veronica.
Hi, Martin. Thank you so much for a wonderful presentation and overview of the All of Us program. I always get goosebumps when I hear your presentation because, as all of us know in this call, we need to diversify our genomic database. Right now, this is not a statistic that probably will shock many of you, but 90% of the genomic data that is available to all of our scientists is of European ancestry, and we need to change that. So I applaud the work that you're doing, Martin, at the NIH, for doing everything that you do in the All of Us program, because all of us are anxiously waiting to ensure that we can continue this movement in really ensuring that all of us are represented in clinical research. So thank you, Martin, for all that you do.
Thanks, Veronica.
And, as I'm bringing up my slides, I just wanted, to thank Dr. Ori and the Texas A&M team for inviting me to share a little bit about the work that we're doing at Genentech. And, as Dr. Ori mentioned at the beginning, it's going to take a village for us to continue moving the work in health equity and truly making healthcare equitable for everyone. My name is Veronica Sandoval. I am a principal in the Patient Inclusion and Health Equity team at the Chief Diversity Office at Genentech. And I am just very passionate about health equity, but most importantly, as a Latina, thinking about how can we and what can we do as industry to partner with our community. You heard from Martin that it is important to have that community engagement and to have that community trust. And, I again applaud what the All of Us program is doing. And in the next couple of slides, what I'm going to share with you is an example of one of those programs that Genentech has been a leader in innovating ways to further engage in the community in ways that hopefully, at the end of our presentation, you'll see the commitment that Genentech truly embraces the increasingly diverse world around us. And we do this because as an innovator as a scientific innovator, we really want to deliver medications that improve outcomes for everyone, for all people around the world, regardless of their zip code, skin color, socioeconomic status. And we are anchored in ensuring that diversity, equity, and inclusion is part of the work that we do. In fact, in 2020, we released our 2025 commitments that anchor in these three pillars that you see. The first is being that fostering belonging pillar, which is looking at our own four walls to see what we're doing for our own employees. Then I'm going to jump to the third pillar, which is that transforming society pillar, which is how are we engaging with our communities to ensure that we are sponsoring and partnering with key community partners. And then the middle pillar, which is the advancing inclusive research and health equity commitment, which is the pillar that I am responsible for, focuses on two main commitments. And those include that by 2025, all of our molecule teams will include a population-specific assessment and inclusive research action plans. And the second is to establish Genentech as a leader and partner of choice in advancing health equity. And these are two commitments that we believe are anchored into our overall strategy and the way that we think about health equity at Genentech. When we think about health equity, and I'm sure that many of you have similar experiences, health equity is very broad, and it's complicated, it's multifactorial. And what this slide is trying to show is that these are the things that Genentech we're trying to target and focus on in order to bring solutions that are essential, again, to putting our patient in the center and promote that they have more equitable access to healthcare. Thinking of those areas, we have health literacy, of course, policy is important. We have a plan and a strategic plan on our philanthropy side, but as well as, what are we doing as partnerships with the community and access to our medications. But at the center of this wheel, what you see is that advancing inclusive research piece. And this is the core of Genentech, as I mentioned at the beginning, as innovators of new medications. We always want to think about what are we doing as with all of these pieces to ensure that we are advancing diverse, inclusive research. And one of those areas, if you look at the center, we launched a Site Alliance program in 2021, where we partnered with key institutions in the community, the City of Hope in LA, Mace Cancer Center in San Antonio, the West Cancer Center in Memphis, and the University of Alabama in Birmingham, to really expand diversity in clinical trials. But also the other piece is that, as Dr. Ori mentioned, we cannot do this alone. So we have actually an external council for advancing the inclusive research that we brought together. And these are a list of prominent researchers and clinicians and health and patient advocates that really keep us on our toes. They really help us think about what it is that we're doing and how can we continue embedding diversity and inclusion at the center of everything that we do in order to ensure that, again, our patients are receiving those medications. And one of the things that we heard from the external council was, Genentech, you need to focus at a local level because the healthcare that is delivered in California can be different from what is delivered in Texas, in Oklahoma, or in New York. So focus on delivering that healthcare locally and what can you do. So that actually inspired us, right? And it inspired us to think of 3 M's. And those are the moment, the movement, and the momentum. How can we help create moments at the local level that can inspire a movement and then continue that momentum in health equity? And one of those programs that we initiated last year, and to our knowledge, this is a unique program in industry, is that we brought the 2022 was the Health Equity Symposia program. And this is one of these programs, here at Texas A&M. And these are community-based events, again, that are focused in addressing the local healthcare disparities that advance health equity in that particular region. We were successful in hosting 27 of the symposia across 16 cities over 13 states. And we were so happy and pleased of the diverse type of these programs, at Texas A&M. You actually, with Dr. Ori and team, delivered a fantastic program last year that focused on precision medicine. And actually, how can you think about ways that not only affect the patient in ensuring that patients can have access to that precision medicine, and especially, again, building those important, diverse biobanks that are so necessary. And in the other sites that you see here, it's just to show you that flavor from, those 27 symposia, from Cleveland Clinic in addressing cancer disparities, Sutter Health with maternal health issues, and Washington Health Alliance with LGBTQ plus mental health. So all this, what all of these have in common, as I mentioned, is that we, with the partnership of everyone that participated, is that a moment was created at all of these levels in order to have a movement to continue the health equity work. And in that movement, I want to leave you with this. And it's a quote of the first Black astronaut, Mae Jemison, that stated, "The future never just happened, it was created." And in order to create that movement, I invite all of you to think, what is your moment in your respective regions? And how can you continue that movement to continue working for all of the patients that we are trying to help, and in order to deliver the best and the most equitable healthcare that we can? So I invite all of us to be bolder this year in 2023 and continue doing one thing at least in 2023 that you commit that you are going to do, and create that movement that our patients are waiting us to be part of. And with this, I would like to end my presentation.